So I did my presentation on multiple sclerosis, and this is a disease that generally affects the central nervous system. There are two parts to the nervous system. The first is the central nervous system, which is the brain and spinal cord, and then the peripheral nervous system, which is the cranial and spinal nerves, the ganglia, sensory neurons, and neuromuscular junctions. The brain is the control center of the body. It's what receives, processes, and evaluates all the inputs that are coming into the body and decides and then initiates a response. The responses can be either voluntary or involuntary, and these responses are required in order to maintain homeostasis in the body. The brain can be divided into four major lobes. Each lobe controls a different function. The parietal lobe, the temporal lobe, the occipital lobe, and the frontal lobe. The brain is connected to the spinal cord by the brainstem, and this is how nerve impulses are sent from the brain to the rest of the body to initiate certain responses. There are many different parts to the brain. These are some of the main ones here. The cerebral hemispheres are the two sides of your brain. They are connected by the corpus callosum, allowing for communication between them. And then each hemisphere controls movement on the opposite side of the body. So the right side of your brain controls movement on the left side of your body, and the left side of your brain controls movement on the right side of your body. The diencephalon is the central portion of the brain containing the thalamus, hypothalamus, and epithalamus. The thalamus is like the relay station for incoming sensory impulses. And then the hypothalamus is what maintains homeostasis throughout your body. It controls the autonomic nervous system and much of the endocrine system as well. The epithalamus connects the limbic system and the other areas of the brain. And then the brainstem is what connects the brain to the spinal cord. There's three parts to this as well, the pons, the midbrain, and the medulla oblongata. The pons is the bridge between the cerebellum and the cerebrum. And then the midbrain is associated with vision, hearing, motor control, the sleep-wake cycle, alertness, and body temperature. And then the medulla oblongata regulates respiratory and cardiovascular systems. And then the cerebellum is for coordination, posture, and equilibrium. Nerves are what carry the impulses from the brain to the certain areas of the body. So there's 12 cranial nerves of 12 pairs, and they originate in the brainstem and they pass into the skull to control the structures in the head and the neck. The spinal nerves, there's 31 pairs of spinal nerves emerging from off the spinal cord. They carry motor and sensory fibers to and from the organs and tissues of the body. And then the spinal cord consists of white matter on the outside, which contains the spinal cord tracts, and then the inside is the gray matter, which contains the nerve cell bodies, the dendrites, and the non-myelated axons. And then this will be important for showing what happens when someone has multiple sclerosis, because the myelinated nerves are what is affected. Neurons are what are responsible for conducting impulses through the central and peripheral nervous systems. There's several parts to the neuron. The cell body contains the nucleus, and then the dendrite is the receptor site. It conducts the impulse towards the cell body, and then the axon conducts the impulse towards an effector, so away from the cell body. And then the axons of the nerves are covered in myelin, and then this myelin speeds up the rate of the conduction. It's formed by Schwann cells in the peripheral nervous system, and then oligodendrocytes in the central nervous system. The breaks in the sheath are called the nodes of Ranvier, and then the nerve impulses sort of like jump, if you will, from one node to the other, and then this is how the nerve impulses sped up. So nerves carry nerve impulses from the brain to the various parts of the body. A nerve impulse travels away from the cell body down the axon, and then is sped up by the myelin sheath around the axon, as you can see in the picture up there, and then the impulse reaches the end of the axon where the neurotransmitters are released at the synaptic cleft, and then usually those neurotransmitters are taken up by a dendrite of the following neuron, and then that nerve impulse is carried on to the next neuron. So multiple sclerosis is a disease of the nervous system because it's progressive demyelination of the neurons of the brain, spinal cord, and cranial nerves. There's many different types of MS. They all vary in their severity, but it's characterized by many remissions and exacerbations. And then it's the second most cause of disability in the United States. The main cause of the various signs and symptoms in MS is because of the demyelination of the neurons. The myelin allows the nerve impulses to travel more quickly on a neuron, and then MS is actually considered an autoimmune disorder. So the demyelination is caused by the immune system attacking its own myelin sheath around the neuron. And then when demyelination occurs, it can either slow or stop the impulse completely. So this affects various body functions depending on which neurons this demyelination occurs on. And then this is just a picture of some of the lesions on the brain that's caused by some of the demyelination, and then imaging of the brain for these lesions is one of the ways that they can kind of diagnose or look for MS. MS is most common in those between the ages of 20 and 40. It's also found to be more common in women. The exact cause is unknown, but like I said before, many believe it to be an autoimmune disorder. It's also thought to have genetic, immunologic, and environmental components because there is increased risk for those who have a relative with MS. So some believe it to be genetic because it seems to be passed on from parents to children. And then a viral infection and immune response have also been suspected as a cause. And then it's also more common in temperate zones, so the northern US. So some people think that could be related to it or possibly be a cause of it as well. So MS is characterized by many remissions and exacerbations. A remission is when the symptoms partly or completely go away, and then it will usually be followed by a period of exacerbations when the symptoms get worse and more severe. During a type of exacerbation, patients can experience total or partial loss of certain functions, just depending on where the lesion and the demyelination occurs. But some of the symptoms experienced during a time of relapse can include muscular weakness, numbness, visual impairment, and then ataxia, which is impaired balance or coordination. The severity of the symptoms really depends on the location of the lesion and then what axons are enveloped. So because that will determine which functions of the body are affected as well. There is no definitive test for MS, but some other tests can be done. Signs leading to the initial diagnosis of MS include the history of the exacerbations and remissions, and then involvement of many focal areas, progression and absence of other neurological diagnostic criteria. So if it doesn't fit all the criteria for another neurological disorder, a lot of times that can point to MS. An MRI can be done. They use the images, like the ones I showed before, to detect the lesions on the brain. A cerebrospinal fluid analysis can also be done because those patients with MS often have elevated protein, gamma globulin, and lymphocyte levels in their cerebrospinal fluid. And then a visual evoked potential test can also be done. This measures the activity of the brain in response to the stimulation of specific sensory neurons. And then if it senses a slowing of the nerve conduction due to demyelination, this also can point them to MS. And then one other thing that can be done is an optical coherence tomography. And then this imaging clearly shows the optical and retinal nerves. So it can show if any demyelination has occurred in those nerves because these are often the first nerves that are affected in a patient with MS. MS, unfortunately, is not curable. many of the manifestations of the disease will continue to progress. As the number of lesions increases, some of the following symptoms will continue to progress, such as weakness and paralysis in limbs, loss of coordination, bladder dysfunction, bowel dysfunction, chronic fatigue, loss of position sense in the upper body, face, and legs. And then these are all just because depending on the nerves that are affected by that demyelination, where the nerve impulse can no longer be sent, so the action will not take place. And then the progression of the disease really varies among individuals, but in severe cases it can lead to respiratory infection, ulcers, and even contractures. So it is important that it is taken care of as much as it can be. There is also no treatment that will cure it. Some medicines, such as the interferon beta 1b, seems to reduce the frequency and the severity of these exacerbations. Some glucocorticoid agents also help to control the acute signs during a time of relapse. And then some other drugs can also be given to target abnormal clotting of proteins in the brain or other complications that can develop as well. And then some drugs are used as muscle relaxants, but really avoiding stress, fatigue, injury, and infection can greatly reduce the number of relapses that you have. So it's very important that you avoid those things as much as possible.